Well, cool. We'll go ahead and get started because we have a lot of fun stuff to cover, and if people join throughout, excited to have them join. But thank you all for joining. It's our first Shatterproof all volunteer call of 2026. I can't believe it's almost the end of January. It is flying by. Hopefully everyone can see my screen. If you can't, let me know. I can stop and reshare it, or you might just have to leave and come back in. Sometimes it just needs a good refresh. I'm Gab Tuggle. I'm the Volunteer Engagement Director. I feel like mostly everyone on this call I've talked to one-on-one at least once, but if not, hello, nice to meet you virtually. I'm so happy to have everyone here. Before we dive in, I just want to give everyone a quick overview on some tips and tricks regarding Teams. I know not everyone uses it. Depending on whether you access our call today via the app or the browser, your control panel may be above or below the slide deck. To enable live captions, you can click on the three dots where it says More, select Language and Speech, and choose Turn on Live Captions. Since this is a webinar, like I said, everyone will be automatically muted when they join. But if not, please just make sure to mute yourself throughout the presentation. And obviously, like I said before, you are all welcome to stay up on camera the entire time. At the end of the call, hopefully we'll have some time for some open discussion and Q&A. So you can ask questions and participate in discussions using some of the following options. Throughout the call, there should be a Q&A box and a Q&A section. You guys will also be able to find that on the top or bottom of your screen. You are welcome to enter questions as you think of them. There will also be our chat is open throughout the entire call too. Y'all are also welcome to plop chats, comments, anything else you'd like in the chat function, and our staff will be monitoring it throughout. And then at the end, hopefully if we have some time, there's also a raise your hand feature. I would love to have you come ask your question live or share anything live as well, and I'll call on you and you can unmute yourself at that time. And of course, if you have any questions about technology, you can also put those in the chat or try to shoot me an email. I'll try to keep an eye on it if you're having trouble as well. So for today's call, we'll kick off with a quick introduction for me and what we'll be going over today. We'll do a brief update on Shatterproof's direction and volunteer updates. From there, we'll get to hear from one of my amazing colleagues, Kristen, who will lead the heart of today's call, which is about Advocacy 101. She'll be helping us understand what's happening nationally and how our volunteers, aka each of you, can use your voices to drive change. And then we'll close the call hopefully with some reflections, questions, and anything else you'd like to share from your own community work. So as I mentioned before, my name is Gab Tuggle. I'll be facilitating our call today. My pronouns are she and her, and I live in Raleigh, North Carolina. Anyone living in an area that's getting a lot of snow this weekend? I'm excited. Apparently we're getting like 16 inches here. Who knew? Not me. Haven't had that many inches of snow in North Carolina in a long time. But I am the Director of Volunteer Engagement, and I get to oversee the implementation and continuous improvement of Shatterproof's volunteerism, as well as all of our communication regarding this work, which is why most of you have heard from me. I oversee our volunteer inbox as well as all of our other volunteer engagement communication. So if you see the name Gab or Gabrielle, that's me. I'm excited to see you here tonight. I can't believe it has been almost a year since I joined Shatterproof, and I just wanted to share what an honor it has been. Your grace, conversations, and collaboration has truly been so meaningful to me, and I can't wait to continue it. I'd also love to have each of you introduce yourselves in the chat. So if you'd like, I'd love for you to share your name, where you're located, how long you've been engaged with Shatterproof. And I also know how much each of you value connecting with each other. So if you also want to share contact information or social media handles, you're more than welcome to do that in the chat as well, as I'm sure other volunteers on here would love to connect. Before we dive in to Kristen's section of the presentation, I wanted to start with a little treat for all of you. Shatterproof recently completed a refresh of our mission, vision, and values. And while we aren't fully sharing this out yet, I wanted our volunteers to be among the first to see it. You all live out our mission in our communities every day, so it only feels right that y'all get an early look at this. I'm going to go ahead and mute the chat on my side so that way I'm not hearing the bings in my ear while I'm talking and I don't lose track. So 1 second while I mute that. I'm excited to see some introductions plopping into the chat. And we also have some staff on here too, so you might see some other familiar faces as well. So one thing I'll say without going too deep is that our new mission, vision, and values captures not just what we do, but why it matters. And each of you are part of bringing this vision to life. It shows that we are one organization, which is super inspiring to me. So I'll read all these new fun statements aloud to each of you, and excited for all of you all to see this for the first time. So our mission is transform systems, support families, and end stigma. Our vision, a shatterproof world where addiction never defines or ends a life. And like I said before, we're wanting this to be one statement. So our vision and mission together to create a shatterproof world where addiction never defines or ends a life by transforming systems for tomorrow, supporting families today, and ending stigma forever. It's been so awesome to hear our staff talk about this and our leadership present this to all of us as staff. So excited to dive deeper into this and share more of the why behind this as we continue to roll this out more across the country. And for the first time ever, Shatterproof has values. We live our shared values driven by science, compassion, and collaboration. We measure what matters and follow the evidence while never forgetting the human being behind the data. It's been really awesome to see all these, and I'm excited to intertwine all of these into our volunteer engagement work as we continue to build that out as well. And lastly, our priorities, and there's been a version of these priorities before that all of us have seen. I know I've talked about our priorities and also previously kind of discussed as our buckets in our work, but these now tie more deeply into our new mission, vision, and values in a much clearer and vision forward thinking way. I also know that this question might come up. These shifts are not going to change the work of volunteer engagement that we've been building out over the past year. Our purpose statement, the tiers that we've been building out are still on the same track. It actually is just more meaningful now because we're actually able to build out more intentional and robust volunteer engagement resources and training for all of you as we continue to build out those tiers. And of course, as always, it's super important to me that we always ground ourselves in our Shatterproof volunteer purpose statement, because this truly is the root of the work that we are building out together and working on every day. We believe in the power of people to change the course of addiction in the US. Volunteerism at Shatterproof is more than service, it's a movement. It's how we honor lived experiences, build connection, and inspire hope. We rally passionate people, those with lived expertise, and those who care deeply to drive change and stigma, support recovery, and save lives. Volunteerism is the heartbeat of Shatterproof, loud, visible, and impossible to ignore. Speaking of our purpose, I wanted to talk a little bit about our volunteers. That's actually kind of fun. Volunteers. Okay, just thought of that now. Wow. Okay. So I just wanted to give a super quick update. We finally have a timeline. I know that this conversation has been happening since I practically started, but we were actually able to put together some pretty tangible dates and times for all of this to start to roll out. So you all can expect to see tier 1 roll out by the end of Q1, so by March. And as part of that rollout, I'll be sending out an email survey soon inviting volunteers to join our external work group and pilot group. We want your lived experience shaping this program, not just staff ideas. So if you're interested in something like that, please keep an eye out as Kelsey and I will be starting to roll all of that out soon. I also wanted to pause and talk about this past year. My supervisor, Kelsey, who's actually on this call, said something in a one-on-one towards the end of the year that hasn't left my mind. I know a few people on staff have already heard me talk about it, but she said, if we pause to recognize all the yes moments, they'll always outweigh the no moments, even when doubt creeps in that we could have done more. That really resonated with me because I'll be very honest with you, like many people who care deeply about their work, I sometimes feel the guilt of we didn't accomplish enough, or I really wanted my words to turn into action faster. But if we take a step back and look at what we, staff, and all of you as volunteers together have actually accomplished, it's incredible. So I'm excited to highlight some of that tonight. So since January 2025, a year ago, somehow, some way, Together, we have built the foundation for a stronger, more connected, and more impactful volunteer community. Here are some highlights that you all helped make possible. We defined our purpose together. We launched the first ever volunteer purpose statement here at Shatterproof. We introduced a tiered engagement ecosystem to create clear, meaningful pathways for involvement based off of all of y'all's really impactful feedback to me when I first started. We also built our first ever volunteer portal, which is really a home for all of your volunteer profiles. We can better track on all of the amazing skills that y'all bring to the table, and also more intentional engagement opportunities outside of just walk. And since launching, over 468 of you have created profiles. 77% of you are first-time volunteers, and 395 volunteers logged over 595 hours, which contributes more than $14,000 in value to our mission. So when you all are attending bake sales or, walking or picking up trash at a walk event and you're like, oh, like, what is this even doing? It's doing something because you all are not only creating a massive impact and showing up for the people who are also walking or, selling the baked goods, but you're also helping us save a lot more money that can go back towards our mission so we can make a better impact over time. We also got to celebrate our first National Volunteer Week as an organization, a huge milestone moment for honoring you and the incredible impact you make. A lot of y'all told me that you felt that there's a lot of asks and not a lot of pausing and gratitude and centering on why we are all here. So I'm hoping that we can continue to not only celebrate each of you during National Volunteer Week, but year round. We also launched new communications that are built for everybody. So we have our bi-monthly newsletters, our quarterly all volunteer calls, and these are no longer limited to just ambassadors. They're for our entire volunteer community. Our year-round walk engagement soared. Some fun fact numbers: in 2024, more than 540 people signed up to volunteer for our walks, but only less than 25% actually attended. But 2025, y'all knocked it out of the park because thanks to all of y'all's feedback on kind of what was missing on getting volunteers at events in the past, helping me create purposeful volunteer roles so y'all know what you were signing up for and what would best align with your skills and passions. Over 75% of you showed up on event day, and many, and like almost all of you, have already re-raised your hands to return 2026. This truly is our biggest engagement shift I feel like has happened at Shatterproof in a long time on the volunteer side, and each of you helped make that happen. Cross-functional collaboration is also growing, aka why we have Kristen on the call today. This year, volunteer engagement became a true cross-functional partner. So many of you shared that you had no idea what was going on at Shatterproof outside of walk or potentially this title of ambassador, and you wanted to dive deeper. You wanted to figure out how you can engage in other ways, and I wanted to figure that out too. So y'all helped me open the doors in a lot of ways to continue to meet with functions across the organization and create more opportunities for y'all. And what does all of this really mean? These wins and metrics are not just numbers. They show growth, direction, and potential. And what I think is the best part is that we're just getting started. 2025 was the year we built the foundation, and 2026 is the year we build the future together. I also wanted to spotlight some awesome things y'all did since our last call in September, another moment of showing that we might feel like we're not accomplishing a lot, but we truly are. We were able to make a connection at World Pride with the vice principal at a Jewish day school in Maryland, who actually, or Virginia, the DMV area. My brain these days is with the DMV. I'm like, where were we? But we partnered with them, and they actually invited us to have a volunteer come share their recovery story to a group of 8th graders. And to the point where all the 8th graders were so locked in. One of our longest volunteers, former junior council member, said he had never been asked so many questions in a 2-hour span, but they locked in, and all of them continue actually to keep the resources in their backpacks every day. Kristen also got to go to their mini mester that we also got invited to, which focused on resilience, innovation, and personal growth. She also got asked lots of questions, and she actually used to work in school, and she said she forgot how many questions middle school students have, but it was really impactful, and I know we made a difference. We also had volunteers show up in a lot of ways at Walk Your Way events and create your own fundraisers, like Tasha, who attended a bake sale. We also had volunteers represent us at walks and hikes and other personal challenges. We had a brand new volunteer who just joined us a few months ago, and Tasha, who's been on the junior council for a little while, both attend the New York City Marathon to cheer on our team Shatterproof runners. We were invited to Trinity College to present alongside Connecticut Harm Reduction Alliance, a very trusted local organization. We were able to have a junior council member go there, sit on a panel, talk to faculty and students about Shatterproof and also his personal journey. And if there's something else that you have been doing in your community, big or small, that maybe I don't know about or maybe I haven't heard about yet, I'd also love for you to drop it in the chat as well. Enough of me talking. I want to continue the momentum. I'm excited to introduce and reintroduce, as she joined our June 2025 call a while back, Kristen Pendergrass, who is our VP of State Policy. Kristen is going to take us through Advocacy 101 session, and I'm really excited for you all to hear it. Advocacy is one of the most powerful tools that we have, and you all are some of our most powerful messengers. So, Kristen, I will stop sharing and pass it your way.
Sounds good. Thanks, Gab. Hi, everyone. It's good to see some familiar faces and nice to meet those of you I have not met before. Let me get my PowerPoint set up and I will launch in. I have a lot to cover, so I'm going to go fast. I talk fast. If you have a question, feel free to interrupt. I accidentally said that to the middle school students and almost didn't get through all my material, but I mean it. If you have a question, if something's not clear, please interrupt me. I'm happy to stop and have a side conversation. So this is what we're going to do. I'm going to real quick introduce myself. We're going to do a quick Civics 101, just so everyone remembers what they learned in 8th grade or whenever you got it. Then we're going to talk a little bit about Advocacy 101, engaging policymakers, and I'm going to do my best to make time at the end to talk about some of the stuff that we are doing in states. I'm in Atlanta right now doing our advocacy work and spent the day at the Capitol, so I'll talk a little bit about some of the stuff that we're up to around the country. So I had my first kind of policy political job as an intern at the National Association of Social Workers while I was getting my MSW. I worked in the Massachusetts state legislature. I then went back to where I'm originally from, which is Oregon, and worked in the state legislature there. I started doing nationwide policy work at the Pew Charitable Trust, working on evidence-based policy and substance use prevention and treatment. And I have been to all 50 states. I'm working on the state capitals now. I'm at 35 or 36. And I've worked with or in almost all the states, probably about 35 or 40. So working on that. All right, so Civics 101. Hopefully everyone remembers there are 3 basic levels of government: the federal, nationwide, your state government, and then your local government. So sometimes it's called a city, township, a county. In Louisiana, they're called parishes, but I like this image because the people are at the top, right? The people make the policy and affect all of this. Hopefully you also remember that there are 3 branches of government: the legislative, executive, and judicial. I am not a lawyer, so I kind of ignore the judicial branch, but I will talk through the legislative and executive branches. The federal government, hopefully this is all familiar. There's just some language things that I like to just remind people of. So like at the federal level, the legislative branch is Congress. At the state level, there's no state where they call it Congress. So if someone's saying Congress, they mean the federal level. At the federal level, also, we know we've got a president, vice president, the cabinet. And then again, we're going to ignore the judicial branch. I'm not going to talk too much about the federal government because the whole idea of like a big fish in a small pond. The federal government is the opposite. You're a very, very small fish in a very big pond. And I have found that it's very hard to have a big impact there. So I like state government because it's kind of a middle ground. I just picked a state, Texas. This is the basic outlay of the Texas state government. Again, you'll see a theme. We've got the executive branch, the legislative branch, and the judicial branch. And then underneath are the responsibilities of each of the branches. This is just to illustrate that while each state is a unique snowflake, they're all kind of the same. They all work basically the same, and with a few outliers, which I will save for another day, they're all basically structured the same. So most of what I'm going to be saying is relevant across the states. And then I just want to point out that there are a lot of local governments. So that big fish, small pond concept, if you want to have an impact, local government is a great place to start. I blew up the legend here just so you can see that like this is every county in America, and the darker they are, the more local governments they have. So there are a lot of local governments and a lot of local elected officials in the country. I also don't really work at the local level, partly just because there's so many of them. And as one person covering the whole country, it's very hard. 50 states is quite enough. Okay, so we're going to dig more into state government. This is an example. Remember, every state is basically the same. So in Tennessee, you see the governor, and then there's all these different agencies underneath. So if you want to talk about like what we do in substance use disorder, we often go to the health agency or the human resources agency. Ultimately, the governor is the person who people advocate with or talk to or reach out to, constituent services, that kind of stuff. Sometimes you can reach out to agency secretaries or directors, but usually when you have beef or you want the administration, the executive branch to do something, you reach out to the governor. In a state, it's a little more complicated. This is Oregon, obviously. The two leaders of the legislature are the Speaker of the House and the President of the Senate. In some states, these are called different things. The Assembly is often the House. Usually it's the Senate, but the House of Representatives can be called different things. We'll talk more about this in a minute, but the best person to reach out to if you want to influence legislation is your state legislator, the person who represents you. But you can also reach out to the speaker, the president of the Senate, or the chairs of any of the committees that are relevant to whatever issue you're working on. So little bit about how a bill becomes a law and where you can influence the process. So when a bill is drafted, one of my former bosses used to say, if a constituent has a thought, an idea, we'll draft a bill for them and introduce it. So you can often work with your state legislator to draft legislation, to write it, and get it introduced into the legislative session. Committees is where a lot of the action happens. They have hearings, they consider or vote on amendments, and then they ultimately vote the bill along its process. And then the bill will go to the floor after it's been considered in committee. Some states allow you to amend a bill on the floor. That seems crazy to me, but it happens. So you could always say to your legislator, I hope you vote for or against this bill, or I hope you adopt this amendment. And then finally, the governor signs the bill. So you can ask the governor to sign it or veto it, etc. So there's a lot of opportunities to have impact. And I'm sure Gab has talked to you guys about this, but that is one thing that we can always help with is figuring out where a bill is, where you can have input, and how to get involved in the process. All right, one other thing I want to touch on, just because it's very apt for the time, is the budget process. So it actually starts before this, but for what the public sees, the governor's budget is usually released around January. This is the example in Massachusetts. In April, the bill is considered in the House, and then just like every other bill, it has to go through both chambers of the legislature. And then ultimately, they have to come together and create one bill that will be signed or vetoed by the governor. So right now, we are in the middle of state budget season in every state in the country, looking at the governor's proposed budgets, talking to legislators about changes we want, and things that they should consider as they look at the governor's budgets and change them. All right, so that's Civics 101. Now we're going to talk about Advocacy 101. So this is a great resource that's available from Shatterproof. We're in the process of updating this. There's not a lot of substantive updates, but it's more style and kind of bringing it up to the 21st century. But we're going to walk through each of these points about how to advocate for legislation. Again, most of this is at the state level as I'm going to be talking about it, but it's really relevant to any state, but also to the federal government with some small changes and to local governments, again, with some small changes. So I'm going to switch the first two and say choose your issue first. Something that resonates with you. This may be something that you know is a problem with in your state, or something that you need to research to find out what is actually happening. But there's a lot of issues in the field of substance use disorder. And I'll tell you, no state, no city has everything figured out. So there's a lot of work to do. Next is do your research. You need to know something about the issue that you are advocating for. You do not need to be 100% an expert and know everything. Like, don't let this be a barrier. But ultimately, this is like actually a very realistic picture of a legislator's office, at least before COVID, when everything went digital. They need to be experts on everything, which means that they're an inch deep and a mile wide. So you probably know more than they do about substance use disorder. And so come in knowing what you're talking about. Talk more about this later, but if you don't know, just say, I don't know, but I'll look into it and get back to you. Next is finding a legislative champion. This is really important so that you have someone to draft your bill, to introduce your bill, and also to really be a champion and shepherd your bill along the process. Uh, Ideally, this is your state legislator, but sometimes you may need to find someone else if they are not amenable to your idea. I talk a lot about best case scenarios because this is kind of what you want to aim for, but then, not everything works out perfectly. So ideally, you have more than one. You have both chambers represented. So you have a representative and a senator. And ideally, it's bipartisan. So you have a Republican and a Democrat, someone with a personal connection to the issue, or professional expertise. So we work with a lot of like nurses, but sometimes we just met with a legislator this morning who's a former police officer, and one of his constituents came to him really upset about recovery residences. So we talked to him about that. So there's a lot of different ways to find a legislative champion and to connect with someone. And also, I just put staff in here because they're so important to the process. They can really be helpful. And sometimes a staff person can be a legislative champion, depending on what position they hold and if their boss will let them. And this is the reason why having a legislative champion is so important, because this is the floor, I believe, of the Connecticut legislature from a long time ago, because Tong is now the attorney general. But this is where a lot of work gets done, and the public is not invited into these spaces. So you need a legislative champion that's going to be vocal on your issue when you can't be there. All right, so next, develop your plan. Messaging and materials. You need something to leave behind. Usually we call it a one-pager, and I really do mean one page. In the course of a day, as a legislative staffer, I would get 20, 30 one-pagers, and you got to think that it was 5 months of session or more. And so like the materials stack up, the emails stack up, really making it concise and accessible. And by that, I mean, bullet points, bold, different colors, like make it appealing and professional, but also make sure that it gets attention. You could think about building a local coalition, connecting with people in your area who also care about the issue that you're working on, including local organizations who may be willing to advocate. And then thinking about partners with a personal connection to the issue and creating kind of a communications plan, how you're going to message this to legislators, to the public, et cetera. All right, meeting with officials and testifying at hearings. This is the part that sometimes scares people because they think, and I hope this is age appropriate, that this is what testifying means. That's Anita Hill, or that this is what testifying means, right? That it's contentious and awful. But in reality, this is more likely what you're going to experience when you're testifying on a bill. I think the last time I testified was for a bill in Massachusetts a month or two ago, and it was over Zoom. I was in my yoga pants in my my living room. It's very low stakes. Even if you're doing it in person, legislators are people, which will be another theme throughout this. This was a hearing in Maine during the pandemic, but a lot of states have continued the ability to testify remotely. All right, and then the other thing to think about when you're meeting with government officials or staff is they're very, very busy. This is actually a real screenshot of a legislator's calendar that I had a friend send to me. They're very busy. Sometimes I used to tell people who would come into my office wanting to meet with my boss that they could walk him to committee, which was about a 2-minute walk down the hall. But that was the time that they had available. So you just need to be flexible. I mean, you should be able to meet with your legislator in particular, but just remember that they are very, very busy. And so kind of try and be as flexible as you can. All right, these next two I usually call 2.0 because they're hard. They take a lot of time, a lot of energy. But the first one is applying pressure through grassroots engagement. So thinking about identifying kind of these turning points when you have an opportunity to make an impact. So you can make calls, send emails, use social media. And this might be when a bill is up for a hearing or when a bill is going to the floor for a vote or when the governor's about to sign a bill. It's kind of like turning points when you may be able to have more influence from that earlier slide with the red on it. There's some tips, and these are things that also we can help you with. So, like scripts and templates. If you're not sure what to say to someone, ask us, and we can help you talk through or write out a script if you're calling or a template for an email. Things to think about, keep it short, avoid harsh language. We're all humans, and we know that this is an emotional issue, but thinking about keeping it as professional as possible. Looking at one or two issues at a time, not having a laundry list. As much as you're comfortable sharing your story, I usually say that legislators are either story people, they like their, pull at their heartstrings, or they're data people. So ideally, you can have both together, have some research, but also, like I said, if you're willing, share your story and make it personal. Explain your key issue and clarify your ask. What do you want from them? They work for you, you pay their taxes. Or your taxes pay their salary? What do you actually want from them? And then this is like a professional thing, applying pressure through the media. I'm still very scared of the media sometimes because, right, it's scary to think about seeing your words in a newspaper or online. But the media can be a really important tool for getting the word out and for gaining kind of popular opinion towards your cause. So letters to the editor and op-eds are great opportunities to get your point across. Press conferences and social media is available to everyone, right? You can always use that to reach a policymaker. And then thinking about timing, your messaging, we have templates and can help you create templates. And then working with reporters. Reporters, especially at the local level, are desperate for stories and would love to work with you to get your message out. They're not going to take every idea you have, but working with reporters can be really helpful. All right, and then I'm going to leave you on this section with this. This is something that a lobbyist that I used to work with, who was mom, wrote up, and I have used it for 15 years now because I think it's so good. The first is being nice to gatekeepers, right? That's staff, that's schedulers. Those people have a lot of power. And even if you're upset or something, it's just really important to be as nice to them as possible. Don't burn bridges, get personal. These are humans. Um, do your homework, like we said, do your research, but also know when to say, I don't know, and come back and give them an answer when you can. There's powers in numbers, so find a coalition, know your audience, know who you're talking to and what they care about. Be flexible, like with the scheduling. Every vote counts, so don't burn bridges, and always, 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 always tell the truth. All right, so engaging policymakers. This part is pretty short. Who are elected officials? These are some of the people that I have worked for. This guy at the bottom is Tom O'Brien. He is the Plymouth County Treasurer, and I worked on his campaign in 2008, and the woman in the top right is his wife. This was my first boss in the Massachusetts legislature. He's now a consultant, but he walked around the state of Massachusetts for one of his campaigns and has four daughters. And um, this was my first boss in the Oregon legislature. He was the majority whip at the time. He ended up becoming the Oregon state treasurer and is now the Oregon secretary of state. This is his house. That's his kiddo, who's probably as tall as him now. But and then this was my last boss in the Oregon legislature. This woman does not know how to cook to save her life. So this picture is like totally staged. But she's actually a congresswoman now. So the point of this is just these are everyday people, right? They sometimes it feels like, oh, they're a senator, they're important. They're just regular people, they're moms and um, just like us. So, all right, how to reach out, looking for opportunities. I don't think everyone knows this, but most legislators have town halls and constituent coffees that you can just show up to. And sometimes you can just talk to a US senator. This is a US senator from Oregon. Every year, he has a town hall in all 36 counties in Oregon. So you can literally just show up and have the ear of a US senator. This is a congressman in California who's having a coffee that any constituent is welcome to attend. This is a lieutenant governor in Vermont, um, is a state legislator in Illinois, and this is a local government official in Oregon. So the best way to get these notices is to sign up for people's emails. So this is a legislator in Illinois that we work with. And I have this on here just because it says sign up to get updates. You can sign up to get updates on from them, and you'll probably get donation requests and some stuff that you don't really want, but you can also get updates about their public appearances. And then their contact information. If you just Google Sean Ford in Illinois, this is his Illinois General Assembly, the House of Representatives. This is his information page. And you can see it's not true in every state, but he's got a Springfield office and a district office. They've got the address there so you can show up. They've got a phone number. It's the 1990s. They've got a fax number and they have an email. So there's a lot of ways to contact your legislators and your government officials. And again, your taxes literally pay their salaries, so they work for you. So if you have something to say, you should reach out and let them know. All right, so then if you're going to reach out, you're ready, you've psyched yourself up, what are you going to say? Either in person or in an email. The formalities, again, they're people, right? You want to say, hi, Representative so-and-so. I'm so-and-so and I live in your district or whatever. You want to tell them something about yourself. I live in your district. I'm in recovery. I care a lot about this issue. You want to ask them something or ask them for something. So I want to know your stance on whatever, naloxone or fentanyl test strips. Or you could ask them for something. I really want you to support this bill, or I want you to increase funding for whatever. Plan a next step. So if you're saying I really want you to support this bill, I will be following the vote and will follow up with you and then thank them because they're regular people and follow up with them. Sometimes we had people, it's a little bit disparaging. We would call them frequent flyers, but it really is possible to like create a relationship with your government official without being annoying or pestering them. You're just trying to create a relationship and you can really be a resource for them too. All right, so this is homework, should you choose to accept it, is figure out who your state legislators are. Most people know who their US senators are. You may know who your congressperson is, but most people don't know who their state legislators are, let alone their local government officials. These are two websites that are out there, but you can also just Google who is my state legislator and put in your address, and it'll tell you who represents you at all levels of government. And then send them an email or sign up for their email updates. Go to a constituent coffee. Just start making the connection and creating the relationship. All right, I'm going to take a breath. Does anyone have any questions? And then I have some time still to go into some of Shatterproof's priorities and some of the things we're working on.
This is awesome, Kristen. Thank you so much. Does anyone have any questions? You're welcome to, it's a small group, so you're welcome just to come up off mute and ask.
Really just listening for now.
Well, thanks, Matthew. Happy that you're here and listening. I feel like that's important and impactful in its own way, so thank you.
Yes.
I do have a question.
Yeah,
Yeah,
let's hear it.
of course.
So with everything that's going on like right now with the like mental health and like the substance use and like everything that's kind of been shutting down due to all of things that are happening right now, is this the right time to be asking and talking with legislative now and like making sure like we have like a set goal and plan like once things get back into, if that makes sense? I don't know if that makes any sense.
Yeah, I mean, it's never the wrong time. Especially it sounds like you just want to make sure that your legislators or your policymakers, government officials are supporting mental health and substance use like treatment or resources or just supporting the issue in general. You could always reach out to them. I mean, it really is not a bad time to do it and just say like, I want to hear what you're working on in this issue. Or you could go to a constituent coffee and say, this is really important to me and I'm concerned and I'd love to hear what's going on at the state capitol. Um, yeah, I don't think there's a bad time. I don't know if that answered your question, but okay.
And
Thank you.
oh, sorry. And Diane asked if we could post the link to locate your state legislator. I know we have the thing on the quorum. Is that the best place, or do you recommend another link?
No, I'm terrible. I just Google it every time. So whatever
Awesome.
pops up on Google, it'll be right.
Awesome.
All right. One more thing just to say, we always do this in January, this kind of like advocacy 101. This is what state government does because 46 states started legislative sessions in the spring, somewhere between January and April. So it's very likely that you live in a place where they are considering funding and legislation relating to substance use disorder. So you've got anywhere from a couple weeks to a couple months to get engaged to sway, the actions of the legislature in that way. Does anyone know I love doing trivia. Does anyone know what the 4 states are that don't have legislative sessions this year?
Does Shannon know and really wants to say it? Is that why she's fighting her?
I don't.
All right, I'll tell you. It's Texas, Montana, Nevada, and North Dakota. They have biennial sessions, so they only meet every other year. There are other states that do biennial budgets, like Washington State, for example, they budget for 2 years, but they usually kind of do some budget tweaking in this year, which is like the off year. So there's still opportunities there.
Oh, you muted Kristen.
Sorry. I'm going to talk through some of Shatterproof's priorities, but why can I not advance my slides? There we go. But before I get into them, I do want to say if there's something that you really care about that is not a Shatterproof priority, we're still happy to work with you to talk about how to get legislation over the board or how to introduce a bill or anything like that. I worked with a volunteer a couple years ago in Washington State who really wanted to get fentanyl test strips legalized in her state. So we kind of talked through a plan and who she should work with and reach out to. So I'm more than happy to do that kind of stuff. So if you don't see your issue reflected in our priorities, don't worry, we're still happy to help. All right, so Gab previewed this. These are our 2 kind of guiding principles for the policy department, closing the treatment gap, better care with better outcomes, and preventing addiction before it starts. So I'm going to talk through a little bit about how we're operationalizing some of these things in terms of policies that we're trying to get changed. The first on closing the treatment gap, just what do we mean by this? So anywhere between 10 and 20% of people who identify as having a substance use disorder and needing treatment get treatment, which means that 80, 90 to 90% of people do not have access to treatment, and we want to shrink that. So one of the things we work on is integrating behavioral health care. So this is bringing like behavioral health screening, treatment, that kind of stuff into the primary care office. So most people get some kind of medical care throughout the year. Presumably, it's most common at your primary care office. We want to bring the behavioral health care into the primary care office. I'll talk a little bit more about what that specifically looks like. The other thing is insurance parity, which sounds so wonky and doesn't really mean anything. But the basic idea is that your insurance covers you for physical health care. We also want to make sure that they are covering you in an equivalent way for behavioral health care. So if you need substance use disorder treatment or mental health treatment, we want to make sure that the physical and behavioral health care are covered by insurance companies at a relatively equal, right? It's not apples to apples, but we have ways of making sure that those are fairly equal. And then we're also looking at the most affected or most vulnerable communities who really need treatment. The way that we've operationalized this is looking at people who are involved in the criminal justice system. We know that a lot of people who enter the criminal justice system have a substance use disorder and would be better served by treatment as opposed to being incarcerated. So we're working on some diversion and deflection policies around the country. And then we've also done some previous work with people, to get people connections to care when they're being released from incarceration, because when people are released from incarceration, they're many times more likely to overdose for a variety of reasons. So that's what I mean by the most affected communities. So the integrating behavioral health care, we advocate for this thing called the collaborative care model, which is basically bringing that behavioral health screening and treatment into the primary care office. And we are advocating for Medicaid to cover these codes of service. We've made a lot of progress. When we started this work, there were, I think, only 15 states that covered it, and now there are 35. So we still have some outstanding work in Minnesota, New Mexico, and Arkansas are kind of our main targets right now, but we have a number of partners that we work with on this issue as well. Next is better care, better outcomes. The collaborative care model, which I was just talking about, also has a lot of evidence that it is very effective and achieves better outcomes. Behavioral health parity and integration is part of this as well. But another thing that we're really still pushing for is expanding Treatment Atlas, which is our quality substance use disorder treatment locator. Hopefully you've heard of it. This is a little outdated, this map, but Atlas is currently available in 15 states, the ones that are colored here. And I think I'm allowed to say this, that we just recently signed a contract to bring Atlas into Virginia. So that will be coming on board in the next year or so, which is very exciting. And we have 2 or 3 other states that are just on the horizon. So it's too early to say something. I don't want to jinx it. But really trying to get this tool more widely available so that people can access the treatment that they need and that's going to be effective for them. All right, and so this is kind of one of our newer policy areas, which is stopping addiction before it starts. Really think about prevention. One of the things we have been pushing in states is youth marijuana protections. So in states that have legalized marijuana for recreational purposes, we want to make sure that the same protections are in place that are in place for like alcohol or cigarettes or other tobacco products. Things like proper labeling, dosage limits, potency limits, placing things behind the counter. So we're not getting involved in the should marijuana be legal or not debate, but making sure that in places where it is legal for recreational purposes, there are just basic protections in place for young people. We've also started working on synthetic drugs. So The intoxicating hemp products, which are proliferating in states that have not legalized recreational marijuana necessarily. Also looking at some of the emerging drugs like kratom, tianeptine. We're working with a couple of states to do either regulation or bans. But mostly our goal is to make sure that these substances are not available for young people, because we know that the effects on developing brains are much stronger than they are on fully developed adult brains. Finally, I guess second to last is our prevention efforts. So states and the federal government spend quite a bit of money on prevention. It's probably not enough, but we're working with states to make sure that the money that they are spending on prevention is being spent on prevention programs that are actually working, right? So what does the evidence say about what is effective? How can we make sure that the money that's being spent is reaching everyone in the state, and is being spent on effective programming? And then we're starting to talk about some non-opioid pain options. We know that, oh shoot, I'm right up against the time. Anyway, this is something that we're kind of exploring, but looking at what options are out there for people who do need pain medicine for to have non-opioid choices in that. I don't have a lot of time for this, but opioid settlement funds is kind of my like extra. This is something that I do a lot of work on. If you have any questions about this, happy to talk more about it. It's kind of my baby. We do a lot of coalition work on this, working on good governance. And we also do a lot of work on making sure that there is transparency in how the funds are spent. So I'm going to flip through this and just make sure that you have my email if you have any questions. And Gab, I left you 5 minutes.
You are good. That was perfect. I feel like every time I listen to Kristen talk, I learn more and more. So good news is I'm sure some of you listening live or who are listening to the recording are like, I don't want to be an activist, or I didn't sign up for when I signed up to volunteer at Shatterproof, this is not what I thought it was going to be. As we grow this volunteer work and this program, this is a chunk of it. We have a lot of people. We even have some on this call who this is their bread and butter. Like, this is why they became a part of Shatterproof. And although I think being in the nonprofit field for a decade, when I was in volunteer engagement, I was like, this has nothing to do with my work. I'm going to focus on volunteer programming. But what's really cool and unique is, especially at Shatterproof, is our team and our advocacy work is everywhere. I sit on a 30-minute weekly call with our team, and I am blown away every week about this new information. And Kristen and Leah are in new cities and new states every time I'm on the phone with them. And although, even if you're not interested in advocacy work at Shatterproof, but you're interested in engaging communities, and people are saying, well, what is Shatterproof doing in this city or this state? I'm sure that we're doing something in the advocacy world in that city or that state that you're located in. So while you might not be going out there speaking to Congress, doing advocacy on a certain bill or a topic that you're really passionate about, might not be your main thing. It might come up in conversation, and just knowing this work and knowing what Shutterproof is doing around this work is important. And you can throw out a bill that our team is working on. You can throw out something that a fellow volunteer went to go testify on. It's important to know, and it's truly intertwined in all the work that we do here at Shatterproof. So I am very excited. Kristen and I have been meeting a lot since I started, and I think we're finally here. Like, we're finally at the moment where we can actually start building out these resources to support y'all. I know there's been some stuff in the past. There was an old toolkit. Kristen and I are going to work on revamping that. We're going to work on creating some one-on-one videos and trainings that y'all can access in the portal, similar to this one. We're going to work on creating some templates and guides, similarly to what she was saying, like, you need this in your back pocket. And our whole organization is going to be working on keeping all of you more in the loop about what's going on throughout time, not just when we need you to call someone or need you to post or share something on social media, but actually just keep updated, understand what our team is doing from start to finish, and also see how you are impacting that work, whether you are the person testifying or you just shared that we're doing something about something in the community. So I appreciate y'all being here. I know we only have 2 minutes. I'm happy to stay on for a couple of extra minutes. I didn't know if anyone had any questions. Jim had a question to you, Kristen. What was the favorite? What did you ask Jim? You said, what was the bill you're most proud of getting signed? That was his question.
Last year, I said it's my baby, the opioid settlement funds, because of I think it's because of the transparency work that we did with Johns Hopkins University and KFF Health News. There were 5 states that made changes. Most of it was legislation, some of it was regulation, to make their opioid settlement spending more transparent. And I think ultimately that's great for accountability and for the public knowledge and to help people get involved in that process, and have input into the decisions that are being made. So I was really proud of that. Good question.
Awesome. Anything else that anyone else wanted to share? Well, thank y'all for being here. I'll just pull up my very last slide because I know some of us.
Wait, let me say something. Let me say something, Gabby. Let me say something.
Sorry, Mary Jo. Go
Hey,
ahead.
but my name's MJ. My name's MJ. It's my birthday today.
Oh, happy birthday,
And I
Happy
just want to
birthday,
say that
MJ.
now
Happy birthday.
I'm a
Birthday,
co-creator now. So if you guys need any social media done, like, so I'm learned and trying to master my CapCut. So now I'm a content creator and I'm a band ambassador in all kinds of aspects. I'm actually aiming for my master's in social work, emphasize on a certified drug and alcohol counselor. And if no one knows, but there's actually a app, is a recovery app that literally you can with mental health, right? So it's dual diagnosis in the palm of your hand, and it's called Effect. And they pay you to learn about yourself, your mental health, and to stay in recovery. And then if you flunk for your drug test, they don't kick you out of the program. And it's covered by It's covered by most insurances. And so I'll have to email you the info, Gabby. But it's been a life changer for me on my recovery journey, and I advocate for it because, like, if it can change my life and if I can help someone else in the same that has substance use disorder and mental health, because we know it goes hand in hand, right? Because I mean, I wasn't getting high just because I liked it. I mean, I was getting high because maybe there was something messed up in me before I knew there was, right? So it's changed my whole aspect of my life, and it's called Effect Therapeutics. And it's recovery and mental health in the palm of your hands. And they actually help people get, if they need more a medical help transition, they help the person suffering get the medication with nurse practitioners in the palm of your hand.
Very
So,
cool.
and I'm ready for 2026. Let's do something
Yeah.
big. Like
need that
I'm saying, like,
energy.
and I said LaShawn Ford. I know his barber.
Oh, you're kidding.
No, I swear, I know his
Love
barber.
it.
If you can see let me show you my hat. So can you see my hat? Oh, why is that my phone
Yeah.
glare?
Blurred.
Oh,
Why is it blurry? Oh, did I break my phone?
No, it's just the background. You're good. There
There it
you go.
is.
oh, cool.
Right.
Oh, that's
That's
So it
nice.
actually became
awesome.
my new name is an executor.
I
So I'm
love it.
Peach's executor. That's my barber, right? Oh, look, there's my. We went to
Oh.
Florida this year.
Love it.
Well, happy
Well, thanks,
birthday.
MJ. Happy
Right. Thank you.
birthday. It's
I'm
good to
29,
see
right?
you.
20 forever 29.
Yeah, yeah.
Well, it's good to see you. Thank you all for coming up on the call. Our next call will be April 15th, but I'm sure, well, I know you all will all hear from me in between then. And of course, if you ever want to chat one-on-one, my link to connect is in my signature, and I'll share it after today's call. But thank y'all so much. Have a beautiful rest of your day.